tell me more about the science behind Alidya.
So the product was actually developed through research from an Italian plastic surgeon and an expert in the field of aesthetic medicine, Professor Pascal Mottolese. And what he discovered was that it was the presence of heavy metals in the fluid between cells and a lack of microcirculation in the skin that were the two major contributing factors to the formation of cellulite. Welcome to episode 2 of In Clinic. I'm your host, Danelle, registered pharmacist and lead practitioner at Clinic 1 Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic 1.
So on today's episode, we're going to be discussing a pretty new and groundbreaking cellulite treatment known as Alidya. Now, Alidya has only just become available to practitioners in the UK, but it's been used for 11 years across 50 different countries, so the evidence base for its effectiveness is pretty large.
That's pretty interesting that it's been around for so long, but it's only just becoming available in the UK. Tell me more about the science behind Alidya.
So the product was actually developed through research from an Italian plastic surgeon and an expert in the field of aesthetic medicine, Professor Pascal Mottolese. And what he discovered was that it was the presence of heavy metals in the fluid between cells and a lack of microcirculation in the skin that were the two major contributing factors to the formation of cellulite.
So this differs from classic cellulite treatment like laser carboxytherapy and lymphatic drainage because it focuses on the root cause of cellulite. So what's actually in the product that's combating these issues of toxic heavy metal and poor microcirculation in the skin?
Well, Alidya has a few active ingredients that help stabilize the extracellular matrix, which is essentially the space that surrounds the skin cells. Now, this makes the environment more favorable for the normal functioning of tissues in that region. So molecules like hyaluronic acid, amino acids, and other pH-regulating molecules in the product are what help to do this. There's also this compound in the product known as editate disodium, which basically acts as a binding molecule to clean up toxic heavy metal deposits in the skin, allowing the body to get rid of them, and this is essentially what improves microcirculation in the area.
That's nice. So what does it say in terms of patient satisfaction?
So there was this one study done in Italy with 56 patients. Out of those 56, 87.5% said that they were highly satisfied with the treatment and they would recommend Alidya to friends and family members.
So, what areas can be treated, and is it just one-time treatment or will someone need multiple sessions?
So the most common areas for the formation of cellulite are the legs, the bum, the stomach, the underarms and the breast. But cellulite can appear in any area of the body where there's a deposit of subcutaneous fat. So in areas like this, patients may benefit from treatment with Alidya, which can be pretty much anywhere on the body. Now, the treatment protocol with Alidya per the manufacturer's guidance is 5 to 10 weekly sessions and a maintenance session every 4 to 6 months. Now, most people will tend to see an improvement in the appearance of their cellulite after 4 or 5 sessions, but this will obviously vary depending on the severity of the area that's being treated.
What's the downtime like with Alidya treatment?
So downtime with Alidya treatment is quite minimal. Other than some redness and potential for swelling and bruising in the area, patients should feel quite normal after they've undergone a session of Alidya.
And are there any instances where someone shouldn't undergo the treatment?
So typically, Alidya has a really good safety profile, but as with all injectable aesthetic treatments, there are some instances where treatment would be contraindicated. So in the instance of pregnancy and breastfeeding, there just isn't enough data to be certain that it's safe to use, so we'd avoid treatment in this circumstance. If a patient has an active infection at or around the treatment site, again, we'd want to avoid treatment here to prevent any further complications. And in the instance of an immunocompromised patient or an immunosuppressed patient, in the instance of cancer, we'd again want to avoid treatment or just be cautious about treating these kinds of patients just to prevent any unwanted complications further down the line.
Are there any other treatments that can be combined with Alidya to enhance the results?
So any treatment that can further promote blood supply to the area would probably be a really effective treatment to use alongside Alidya. So something like polynucleotide treatment, which promotes the formation of new blood vessels, would be really, really useful in helping combat one of the root causes of cellulite, which is poor microcirculation in the area. So what I always recommend is that people put themselves in for a consultation just so we can get a real good understanding of what their needs are. If you'd like to book yourself in for a consultation or learn a little bit more about the treatments that we offer, you can hit the link, which will take you directly to our link tree, where you can get access to our WhatsApp number. You can call or message us directly. You'll also get access to our treatment guide, which you can download directly to your device, which will give you a load more information about the treatments that we offer and help answer some frequently asked questions.
Don't forget to like and subscribe if you've enjoyed watching today's show. Hit the bell if you're watching on YouTube to get notified when the next episode is out, and leave a comment if you have anything interesting to say. Thank you for watching.